In this scenario, the patient has fallen on ice on their outstretched hand. There is swelling, bruising, and palpable crepitus of the distal radius. They are unable to make a fist and don't have much strength in the hand. So I'm guessing it's a closed wrist fracture. We are now in a safe area away from hazard, and I am wearing gloves. I'm going to splint the area for pain relief and stabilization until we can get further medical attention. First, I'll check for CMS. We'll check capillary refill. I'll ask the patient to wiggle their fingers and then check for feeling in the fingers. So close your eyes. Which finger am I tapping?
Index.
Nice. First, we'll use a SAM splint to stabilize the wrist. Then we'll take the sterile gauze and wrap it all the way around to keep the splint in place.
Ow!
Sorry. Don't worry.
Ow!
We'll be okay.
Ow!
And we will pin that in place. Next, we'll take the triangle bandage to make a sling. And we'll pin that in place. And now we'll check CMS again. We'll check capillary refill and sensation in fingers. And then we'll call 911 or take patient to the hospital. From this position, we can give the patient some ice, and this way the elbow is stabilized so that the patient can walk around and move from the injured area to seek further medical attention. In this scenario, the patient has come in with the worst headache of their life for over 30 minutes. They have a history of headache, but nothing like this before. Their speech is slurred, and the right side of their face appears to be not moving. The scene is free from any hazard. So I'm going to call 911 immediately, and we'll use the Miami pre-hospital checklist to check fast. So for speech, we'll have a patient say a saying such as, "You can't teach an old dog new tricks." For facial drooping, we will ask the patient to smile or show their teeth. And for motor, we will ask the patient to raise their arms, close their eyes, and raise both arms. And then we'll also monitor the time. At this point, I am monitoring vitals, and I have positioned the patient on their back, and I've loosened any tight constricting clothing. I am also prepared to turn the patient on their side if needed, and we're waiting for help to arrive.